So for my wound care, I will be doing suturing as if I'm tending to a lip laceration. I will be using this upper right hand corner as my lip laceration. So essentially you always want the area to be clean before you do any type of closure. And the tools I'll be using for suturing today will be my hemostat and my forceps. I'll also be using the polyester braided thread because this is said to work good in mucosal areas. And so since we're doing a lip laceration, that's the thread I'll be using today. Pull it out. You'll see the needle gauge right there. I'll go ahead and clamp it using my hemostat, making sure that it's about 2/3 of the way from the tip. So in order to ensure that everything stays sterile, I'm going to be using gloves to open up my thread. On this thread, it shows that it's a 3 gauge, and so typically with needle gauges, the lower the number, the larger the needle gauge, like so. So now that I have my needle gauge in place with my hemostat, my other hand I'll be using the forceps to help me guide the needle through. So essentially what you want to look for whenever you're looking to close a wound is that you'll go twice the width of the wound in distance away from it to begin suturing. So as we begin, I'll go twice the distance away, making sure that my needle is coming in at a 90-degree angle. As it pokes through the skin there. And then using my forceps, I'm just going to use it to kind of push that skin down on the opposite side, so that I'll be able to then re-grab the needle with my hemostat, pull it all the way till it gets to where I have enough thread at the end to tie off. But before I tie off, what I want to do is get that needle through the other portion of the wound on the opposite side. So going in the same depth and width as it was on the opposing side, and pulling that all the way through. So then next, what I'm going to do, I'm going to drop the forceps. So now that I have the thread in this hand, I'm just going to help it to maneuver around my hemostat. So loop it around twice, pull this side of the string through those 2 loops I just created. And this is going to allow me to pull the 2 ends together. So I'm going to try to do this second knot a little quick so that my approximation doesn't let go. I'm gonna do these knots about 3 or 4 times. So now that we have that first simple interrupted suture, I'm just going to continue to do simple interrupted, because since we're dealing with a lip laceration, the lip maneuvers in a lot of different ways, and so I don't want to go uninterrupted for the simple fact of really adhering to the facial features of our patient. So again, now that we have the thread on the opposite end of the wound, I'm just going to kind of give a little bit more right where we started it so that I'm able to tie it off. So going twice around the hemostat, grabbing that thread on the original side, pulling it through, pulling them tight close together to get that approximation, and then twice around the hemostat again, grabbing that thread, pulling tight. And again, we do this about 3 to 4 times. And there you have 2 stitches. Using my iris scissors to cut off the remaining pieces. Since this wound already has good approximation, I'm just going to put it right at the ends of the wound so that we get good healing there. So grabbing the needle, coming in at that 90-degree angle, twice the distance of the size of the original wound. Using my forceps to help guide me. Pulling that thread till I have enough on the end to help me tie it off. Two loops around the hemostat. Approximating. Here's my second tie. Third. And fourth. So now that we've fully closed the lip laceration, this is what it looks like. This upper right hand corner we were working with, this is how the wound looked before. And so this is after full approximation, closure between the middle and through the end of the wound. So this closure will allow for good healing